something that comes up often with patients when they speak to me, is so many people comment on that their initial diagnosis of their cancer was incorrect. Whether it was not a sarcoma and then was a sarcoma, or whether it was always a sarcoma, but that the subtype changed, the grade of the tumor changed, something changed that could definitely impact their treatment plan. What advice would you give to people who are about to undergo pathology or have undergone pathology reports with regard to their disease?
Sure. So I sort of alluded to this before. Training in bone and soft tissue pathology, it's not that it's hard to come by, but I think first of all, you have to have a passion for it, because it's not the thing, it's not primary in most training programs. And then I think you have to be at a place where the exposure is there. So for sure, there is an issue in terms of, I don't want to say lack of expertise, but I think most general surgical pathologists would say to you that they probably don't feel comfortable diagnosing these tumors. I believe that treatment of these tumors should be at centers like this. I think there's never no patient's family should ever feel guilty about asking for a second opinion or an outside review. I can say to you that every patient who comes to be treated at LCI, their material, if it's not been diagnosed here, will be reviewed here, because it's very challenging. I mean, it's a very heterogeneous disease. There's lots of different tumor types. A lot of them sort of overlap, and it can be challenging to diagnose these. And there have been times where we've thankfully saved patients from having to have surgery or having to have chemotherapy or radiation therapy. And unfortunately, there's times where we give bad news, where they might have gotten a diagnosis that was benign or sort of low grade, and unfortunately we have to give the bad news if that's not the case. So I think that most places would definitely, nobody should ever feel, no pathologist, no physician really should ever have an ego such that if a patient wants to get another opinion that we would have a problem with that. So if you feel uncomfortable at all, you shouldn't. Just say, I would like to have it reviewed, and more information is always better. And then I think, again, rest assured in the knowledge that when you come here, that really every person that you're going to meet, from the coordinators to the surgeons, radiologists, every one of us is specially trained. Every one of us is focused and passionate about sarcoma. It's sort of what we live and breathe. So there's not going to be sort of an expertise vacuum in any aspect of our program here. So I think that you really need that. I think that you need that in it doesn't matter what disease you have, what kind of tumor you have. I mean, I make the comment that I would always want the best pitcher on the mound, every game. So there's really, and I think that we have that here. I mean, we have stars across the board. So I think you should be looking for a place where you're comfortable. I hope that our patients and our patients' families are comfortable here, where I know we're all happy to serve them.
I just get incredible feedback from patients and families, whether the outcome is disease progression or disease stability or disease shrinkage. No matter what the story that is going on with the family is, they across the board always say to me that the care is second to none at Levine Cancer Institute, and that they're treated absolutely like family, and they are so attached to every single person that they come in contact with there, and the feedback is just blows me out of the water. It's so positive, and just makes me so proud to know that, that we're partnered with such incredible people.
Well, I'm really happy to hear that, and I'm proud to participate in the shadows as I do.
You're not in the shadows in our eyes, so that's why we wanted to bring you out from the pitcher's mound and put the microphone on you and tell everyone more about who you are and what you do and why you're one of the main people in this initiative at Levine Cancer Institute. So thank you so much for your time today, Will.
Thank you so much.
We just appreciate you so much.
Okay, well, take care.
Take care. Thank you so much, Will.
Sure, bye-bye.